Good evening, everybody. At the onset, I would like to congratulate Vaishali and thank her for making me a part of this fantastic mind-body medicine symposium. To be very honest, I want to actually say thank you to Vaishali for thinking out of the box and making me think out of the box. When I first read the topic assigned to me, hobbies as stress busters, science behind, I was a little flummoxed. I was like, okay, what am I going to talk in this? I mean, is there some science behind hobbies? I just thought it was something you do. I mean, something that you like doing and something that you just do when you have time. Does it really help you? When was the last time I really indulged in a hobby? I started talking to a few colleagues around and I realized that, yes, most of them do have long forgotten hobbies that they wish they could go back to, but somehow have never managed to have the time to do so. And the entire process of preparing for this lecture, to be very honest, was almost cathartic. And the reason I'm saying cathartic, because I learned so much, I read so much about it, and I think somewhere a little bit of me changed, and I began to understand that yes, hobbies are stress busters, and there is an enormous amount of science behind it. An enormous amount of science which maybe sometimes you're not able to absolutely quantify. And as scientists, which are so used to having quantification of everything, when you are actually not able to quantify it in absolute, maybe numbers, maybe in black and white, you're always having that, somewhere along the line, the query in your head that, okay, is this really for true? And I really honestly hope that you enjoy the next 20 minutes with me as much as I enjoyed reading about it and as much as I learned about it during the process. So when I actually went to something very basic, I actually went to what is a hobby? I mean, when I'm saying hobby, what am I talking about? And you realize that by the basic definition, it is something that you do for pleasure. Most importantly, during your leisure time. And an honest question, I mean, I would have loved this to have this topic in a physical meeting, because I would have actually asked all of you out there that where is our leisure time? Is our leisure time in midnight? Or is it that time also that we're looking at our mobiles and trying to see to that we keep in pace, trying to sort of, put the last like of the day for something which actually sometimes I really wonder has any meaning. But when you actually talk in concept, we talk about the concept of hobbies, this could be creative, this could be athletic, this could be intellectual, this could involve anything practically on planet Earth. For example, it could be dancing, it could be singing, it could be skating, it could be gardening, it could be anything that you actually enjoy doing. It could be meditation. I know a number of my colleagues who do Vipassana. Our chairperson over here is an expert in it, and I'm sure Archana could give us some fantastic tips on Vipassana. And of course, spending some time closer to nature. Again, I have friends who actually swear by hiking. So when you are talking about a basic definition, it is very simple. You do something that makes you happy during your leisure time. But tell me, friends, when was the last time you actually thought about a very big question? What makes you happy? Are you happy? A very, very pertinent question, I think, in present times. Is there data? You would be surprised. Apart from all those blogs that you read, there is actual data. There is a significant amount of data out there. And one of the papers which was very interesting was where it was categorically shown that yes, leisure activities which you enjoy are associated with both psychological and physical well-being. And when we are talking about the mind-body connect, we know that we are talking about both psychological as well as physical well-being, because both go in tandem. One cannot actually exist without the other. And I am glad that we're increasingly beginning to understand this. I'm glad that we're talking about this in the forefront. I'm glad that we are now, as clinicians, as medical community coming together to talk about both psychological and physical well-being. So when I talk about health benefits of hobbies, what would I talk in terms about? To this audience, definitely mental health, paramount importance. Our professional lives, very important to all of us, improves your performance over there, helps you solve problems better. Very, very important, builds better relationships with your co-workers. And last but not the least, makes you more empathetic. And empathy is, I would say, the second name for our profession. Because unless you are empathetic about your patient sitting across you, unless you're empathetic with your staff, unless you're empathetic with your co-colleagues, you really cannot lead a fulfilled life. That is the area where hobbies do help you live better. And not only that, when you are actually doing something in your leisure time which makes you feel happy, it does reduce that enormous amount of stress that you face in the clinical world when you're actually working an actual practice. What was very categorically shown that adults, when they actually practice art, which can be any kind of art, simple art, they were more relaxed, they were more enjoyed, and they were more enjoyed and more aware of the time that they were spending in the art. And last but not the least, more helpful. What this also translated into was an increasing desire to continue improving their skills. And that's what happens. You realize that when your colleagues, you have some fantastic painters in this audience, you have some fantastic wildly artists in this audience, they have the desire to continue improving their skills and really always tell you that it really relaxes them. Cortisol, a hormone which is a stress hormone, which has always been conventionally associated with the fight or flight response. We know that when these levels were measured before and after these sessions, what was seen, that there is a noticeable decrease in this stress hormone. Don't we all want to reduce our stress levels? Is something very simple, something just below your nose, something that is easily doable to reduce your stress, really not being done? Overall well-being. What do you mean by overall well-being? This study in New Zealand actually very, very elegantly showed that when you participate in activities that bring out your creative side, which, to be honest, when I was reading this article, I was really wondering whether I had a creative side, but it did lead to an increased sense of well-being. Positivity, upliftment, less likely to feel low or depressed, happier, relaxed. Isn't that what we all are searching for at the end of the day? So what is it that still does not allow us to promote mental health when categorically it has been seen that both positive and negative psychological stress markers, when it was seen that when you looked at these markers, it was found that those who actually participate in leisure activities, they not only had a lower BP, a lower waist circumference, but also a lower BMI. In this epidemic of obesity that we are talking about, in this entire way, all the time are talking about lifestyle changes, when we are talking about medical line of therapy, when we are even talking about bariatric surgery, are we missing out the bus when we don't talk about mental health in our patients? Is this one of the major contributing factors to the increasing epidemic of obesity? Because there will be a significant number of patients out there who you would realize who do not respond to therapy in spite of following lifestyle. Is it that the hypothalamus, is it the hedonic center, is it the executive center, is it a combination of all these factors that is actually contributing to that inability to lose weight? Any kind of physical activity, especially if you take it outside, especially if you go a little closer to nature, even as minimal as 10 minutes, can improve mood and better focus. But how often do you and me do it in a busy day? We would have a number of excuses for not doing it. But are those excuses good enough? Because there are a number of studies out there which shows that people who actually take part in physical activities have fewer days of poorer mental health compared to those people who do not exercise. Again, a very pertinent question. Why are we not doing it? I think this available nights and weekends is something which is very, very relevant to us. We as doctors have become so used to being available nights and weekends. I think we almost get FOMO, and if I'm allowed to use the word FOMO out here on such an elite platform. I mean, my children always tell me, Mama, you get the feeling of missing out, and that's why you tend to look at your mobile at odd hours before you go to sleep on weekends. But what was seen is that employees who experience more psychological detachment from work when they have their off hours have higher life satisfaction and less psychological strain than those who don't disconnect from the job during non-work hours. Is this the reason why we are seeing more fatigue? Is this the reason why doctors are facing more burnout? Is this the reason why we are more tired? Is this the reason contributing to reduced lifespan in doctors? So many questions, still few answers. And I really hope that symposia like this do contribute to us actually getting answers as to what is the reason, why is it that we need to be available nights and weekends, and why is it that we cannot become more detached after work. And when it is very, very categorically seen over there that workers who are more detached after work were no less engaged while at work. Very, very interesting again. That means we need to detach. We need to not be available all nights and weekends so that we can actually recover from the psychological stress of work and be able to actually give more quality time with our patients, spend more quality time with our patients, and be able to give better output as doctors. Would short breaks help? They do. Even short breaks can improve attention. University students were given a task that involved sustained attention for 45 minutes. There were 2 groups over here. Dr. William Helton, who has done a lot of innovative work in the field of applied cognitive psychology, when analyzed these 2 groups, where one group worked for 45 minutes without any break. The other group took a 5-minute break. It could be anything. It could be simple breathing. It could be yoga. It could be taking a walk. It could be listening to music. A 5-minute break, but was given midway to one of the groups. What was seen, friends, was that all the students in the break groups actually performed better on the attention task. Why is it that the brain gets exhausted after any significant amount of prolonged cognitive effort? What is it that exhausts the brain? Is still an answer not completely, is still a question not completely answered. But the fact remains that if students are given a break during their cognitive effort, they do perform better. And that extrapolates even to us as clinicians, that if we learn to take a break in our busy schedules, we would perform much better, have much better outputs at the end of our days. Relationships. I think we all have been guilty of not really looking after relationships the way we would want to. Though doing activities in groups enhances your communication skills, it builds healthy relationships with others. But as groups, how much of activity do we really do other than work related? What was interesting is that though many people go through a sense of loneliness at different phases in their lives, if this prolongs for a long time, this can be unhealthy. And when it is prolonged, definitely it is going to result in poorer physical, mental, cognitive health. And when there is poor physical, mental, and cognitive health, we all know this is going to translate into some of the chronic non-communicable diseases like obesity, hypertension, dyslipidemia, diabetes. Now, what was very interesting when I was reading about this entire topic was that just not having sufficient social activity for a long duration, mind you, is as bad as smoking 15 cigarettes a day, an eye opener. That means just no social activity? Is it equivalent to me smoking 15 cigarettes a day, which is something which is absolutely taboo? Again, another eye-opening question for all of us to sort of chew over. Eustress. I found this again very, very interesting, because even people who aren't overly stressed, I always thought that, if you have to be overly stressed and all these problems would occur. But people who are actually understimulated, hobbies are a nice source of eustress. And what do I mean by eustress? It's a healthy kind of stress where you feel excited about life, like, oh wow, I want to do this. If your life is dull, uninspiring, you just don't know what you want to get up in the morning. And often your patients will tell you, I might get up in the morning and look at the day and think, oh my God, the same day, there's nothing new. It's going to be the same routine. I just simply don't want to get up because it's the same routine. Hobbies, friend, can give you meaning, can give you fun, can break up a boring schedule. That means just the right amount of challenge for you to actually be happy in life. Actually look forward to something in life. It could be meeting your friends. It could be actually as simple as just gossiping. It could be so many things that you could be enjoying in your leisure time. And they could give you the right amount of challenge to enjoy your life, to actually experience eustress so that you can have a much more fulfilling life. Again, enjoyed reading about positive psychology, read a lot about positive psychology. And again, as I said, a lot more reading left to be done. So much of literature available out there, so much of literature available about mind flow, about mindfulness, about how do you make life worthwhile. As I said, I'm sure Archana would be able to talk much more about it than me. And you discover what actually brings fun to life. Because without fun, life has no meaning. And what is seen that if you do activities that bring fun to life, simple hobbies that incorporate pleasures into your life, your overall sense of joy does increase manifold. And this is again going to translate into a stress-free living, which is going to translate into stress busters, which is going to translate into reduce a number of reduced chronic metabolic diseases. One of the very important causative factors of any kind of NCD has always been stress, which we have always just read as one of the causative factors, but never really paid too much of attention. Never I try to understand and identify what we mean by stress. And never also try to understand and identify that how could we actually reduce this stress? Could gratification help? Where it's a challenge that requires us to use some of our personal skills and engages us in a sense of flow, where you actually have a near meditative state, where you lose track of time. You feel removed from the stresses of life and fully engaged in what you are doing. Actually, while making this slide said, I was wondering whether I'm getting gratified, because I did reach a point of time where I lost track of time and I was really fully engaged in trying to understand where do hobbies fit in and how do I actually understand better where could hobbies help all my colleagues who are listening to me. Sense of well-being, definitely. Reduction in stress, definitely. And all kinds of reduction in stress is going to translate into a reduction in all kinds of chronic metabolic disorders, the metabolic syndrome, even disorders like thyroid, as we all know, are increasingly associated with, whether you look at hyper or hypothyroidism, we have seen that stress is one of the precipitating factors. But as I said, difficult to quantify, so easily ignored. That is what we do in the clinical world. What happened in COVID-19? Did leisure engagement help? Did it help our adults to deal better with the situation? Was it a point of time when we connected with our inner self or with our families or with our friends, tried to understand better how to live life? Or have we forgotten the lessons COVID taught us? Data shows that yes, after controlling socio-demographic and context-specific covariates, what was seen that there is a definite association between changes in leisure engagement and, mind you, different aspects of mental health. It could be perceived stress, which was very, very visible in COVID times. Depressive symptoms, a number of our patients went through depression because of varied reasons, and mental well-being. All these aspects of mental health were helped by leisure activities, were helped by hobbies. And hobbies did play a very, very important role in facilitating stress alleviation and actually helped well-being enhancement during all these taxing events such as COVID-19. So why do we not turn to them when we are actually stressed out, when we are actually taxed? Why do we not turn to our hobbies? Why do we not indulge in leisure activities? Why do we all the time perpetuate this vicious cycle of stress begetting more stress and finally converting into a number of metabolic disorders? So take a break, friends. You deserve it. Work-free, responsibility-free time in your schedule. You need to recharge your batteries. Do something you enjoy. May be difficult. You may not be able to give yourself permission to take a break. But sit back, relax, try to understand where you come from and where you are going. And how would you do that? How are you going to make time for hobbies? What are you really going to do? Are you going to be able to take time out every day? The biggest excuse that I hear, both from patients and from friends, is I just don't have the time. I simply don't seem to be able to fit what I want to do into my schedule. Are you prioritizing it? Why don't you take a long-term approach? Find gaps in your schedule that you can fill. Create those kind of gaps in your schedule. Recently, a very good friend of mine, I mean, if I can name his name, Dr. Sachin Mittal, I met him recently in a conference, and he told me, ma'am, after every 2 hours, I practice 5 minutes of yoga in my clinic. I practice 5 minutes of breathing. And the 2 days that we spent together, he actually taught me how to do it. So it's not a question of not being able to do it. It's a question of actually making that time so that you can do it. If you are unable to do it every day, how about allocating a few hours every week? Or if you can't do it every week, every month for such activities. Maybe take a 2 to 3 day break. Maybe take a vacation. Maybe go for a long walk. Maybe go for a drive. Maybe listen to your favorite music. Maybe dance crazily on something that you would love to do. But do it. The reason do it, it is going to translate into a healthier mind and also a healthier body. Multiple small breaks during your work, the world will not end. If after, for example, every 10 patients, you take a 5-minute break and sort of realign yourself, it is going to actually improve your productivity. It is going to help your output. It is going to help you connect better with your patients. And that is what you want at the end of the day. Most importantly, what you need to really understand, friends, is what is it that is taking up most of your time? I realized a lot of my time was being spent on social media, looking at WhatsApp, trying to answer WhatsApp. And then I realized that the amount of time I was doing with that could easily be translated into doing something more constructive and to doing something that I would really enjoy doing. And once you become mindful, once you become aware that, yes, you can sort of, snatch a few hours from non-constructive activities into something that gives you happiness, into something that is going to really act as a stress buster for you, you realize that, yes, you do have an answer to all the significant amount of stress that you go through. I'm going to leave you with the final thought in my brain. If you are losing your leisure, look out. It may be you are losing your soul. Very, very, very profound words, I would say, by Virginia Woolf. And I would like to end my conversation with you over here and hand it back to Archana. Thank you very much, friends, for your patient listening. And as I said, I hope this conversation with you does result in all of you going back today and thinking, what was my hobby? What is my hobby? What is it that gives me happiness? What is it that gives me pleasure? Because I am going to practice that. Because once I practice that, it does result into better mental, physical, and cognitive health. And at the end of the day, that is what I want. Thank you very much for your patient listening.
Shehla, for that amazing lecture. So many points, not only for us, but also to tell our patients. I feel we all need to prioritize. We are not supermen, we're not superheroes, superwomen, but we need to prioritize what we put on a plate. And leisure, hobbies is a very important part of the food which we put on a plate. So I guess we all should move from FOMO to JOMO, that is joy of missing out. Very important. I liked your concept about eustress. And I feel it's very important because a little constructive stress which excites you, which challenges you to think, to grow new connections. For example, my personal example, I'll tell you, I probably just enrolled for a dance class and I was dancing with children, 10, 12, 14-year-olds. And I had a tough time coordinating, telling my right thumb to talk to my left little finger, my right toe to talk to my left heel. And as I needed more practice, the kids were picking up quickly, but at my age, I had a tough time. But a few sessions down into the line, I'm realizing how my own synapses are opening up. And it's been a pleasurable journey so far, and I intend continuing it. It's not a long term, it's not a daily thing which I do. Probably, yes, what you suggested that we slot out times, maybe once a week, twice a week. But at the end of the day, if you see your progress in 6 months or 1 year, you've really gone a long distance. So that really would help you to, for our patients also, which to help them manage their stress better, the diabetes better, and lead a more happier and fulfilling life.